So basically, we are discussing about regulation of blood pressure. So basically, yesterday we talked about how the blood pressure maintains. This is one thing. Maintains means we started our day at 7 o'clock means after wake up, fresh up, after breakfast, then we do some exercises, or after exercise we do uh, breakfast. Then after we will go to the office for work, and then afterwards we work there. Then we do lunch. Then afterwards some 10 to 15 minutes nap. Then afterwards we continue our work. Then we have some snacks times. Okay, so likewise we will have different works in different timings. Okay, so body have to maintain the blood pressure throughout the day from beginning to wake up to sleep. Okay, this is the maintaining. For maintaining, different body uh, systems or different body parts or different organs will help. Likewise, yesterday we talked about pumping system. Okay, in that we have respiratory pump, skeletal muscle pump. Okay, this will help us. And also veins also constrict because they are made up of smooth muscle. And we have different types of hormones which help to maintain the blood pressure throughout the day. So basically, pituitary gland, ADH, ANP, aldosterone, epinephrine, non-epinephrine. So they have different types of work they will do. But here, what happened? One condition I will explain you, that suddenly one good news you listen in your home or anything, anyway, you got lot, you got some amount, your elder brother gave you a gift of anything, gift which is very precious to you, very valuable thing. So suddenly you have the feeling, very happy feeling. Okay, something which gives you pleasure. Okay, it will give happiness to you. Okay, so basically, at that time, the BP levels are no, they have to maintain the blood pressure. So in that time, your heart rate may be increase or decrease because you are in a very wonderful mood. Okay, this is the one. Second condition is that if something happen, okay, someone failed in the exams, someone have got accident, okay, and any bad news occurred, some person died, so something shocked happened at that moment. So at that time, the body will respond in opposite condition. So at that time, you have to maintain the blood pressure. Okay, this is not maintenance, but regulation. What we call is regulation. So one scenario is that, second scenario is that in both condition, the blood pressure is in normal level. It may be increase in happy moments, or some changes, fluctuation will happen in depression. It may be also increase, it may be decrease. Okay, so body will decide the external environment. So depending upon the external environment, our body will decide with these two mechanisms. Okay, we have two mechanisms. What types of mechanism? One is intrinsic mechanism, and second one is nervous mechanism. What we have? Intrinsic mechanism, and second one is nervous mechanism. So intrinsic mechanism is different and nervous mechanism is different. So we will discuss all those two things here. First is intrinsic mechanism. So which mechanism, which work will regulate the blood pressure? Simple terms. The term intrinsic means within. Intrinsic mechanism work because of the internal characteristics of certain organs. The first such organ is heart. So intrinsic means within. So the within the organs, okay, there's the organs that which support to regulate the blood pressure. So what are those organs? First organ is heart. So first start with heart. Heart itself will support to regulate the blood pressure. When when venous rhythm increases, cardiac muscle fibers are stretched and the ventricle pump more forcefully. Thus, cardiac output and blood pressure increases. This is what happens during exercise. When a higher blood pressure is needed, when exercise ends and venous resistance decreases, the heart pumps less forcefully, which helps return blood pressure to a normal resting level. Okay, so here one example is giving that is exercise. When you are in resting position, your blood pressure is slightly low. When you are doing any exercise, any work, lifting things, going, walking, running, anything, or uh, you are going up, down, and downwards, whatever may be. So the blood pressure increases. So how is happening? Because the venous return is more. So yesterday I told you that our BP is depend upon venous return. So if the venous return is more, so we have more amount of blood in the right atrium. It will go to the left ventricle to the lungs, lungs to right atrium to left, sorry, left atrium to left ventricle. So in the left ventricles or right ventricles, the blood is more. The venous return is more in right, and here uh, the oxygenated blood is more in left ventricle. So what will do? The heart will force very rapidly, very forcefully, more forcefully. So then what will happen? The blood in the ventricles will go to the all body parts during exercise, during any strenuous work. But you are in resting position, the venous return is less because you are not doing any work. Okay, so what will happen? Venous return less. So right ventricle and left ventricle, the blood is less. So heart will doesn't require more amount of force. So in the less amount, the force, less force, the blood will pump to the all body parts. So this is the one thing which help intrinsic factor. In the second is kidneys, because very important, kidneys. Okay, when blood flow through the kidney decreases, the process of filtration. So basically the second intrinsic mechanism, that is kidney. When blood flow through the kidney decreases, the process of filtration decreases and less urine is formed. This decrease in urinary output preserves blood volume so that it does not decrease further. Following severe hemorrhage or any type of dehydration, this is very important to maintain blood pressure. So second is here kidneys. Kidneys play very important role. Second in second paragraph that is coming, because when a condition, same condition we are taking that, when you are in resting position, what will happen? The amount of blood which will reach to the kidney is decreased. So the blood is decreased. So what will happen? Kidney filtration also decrease. Kidney filtration decrease, then urine output also decrease. So this is the step-by-step procedure. Second thing, if the blood flow increases to the kidney, filtration increases, then urine output increases. Okay. So likewise, kidney uh, helps to maintain blood pressure. So if the blood pressure is low, so what will happen? Kidney produce less amount of urine output. If he produce large amount of urine output, then what will happen? The blood pressure more decreases. So this is how kidney helping. If the blood pressure is increases, the kidney, if the kidney do opposite, what will happen? If he filter less amount of blood, what will happen? Urine output decreases. Again here blood pressure increases. So that's kidney will do according to the condition. Okay, this is very helpful. First is heart and second is kidney. And kidney have another thing, that is here we'll explain that the kidneys are also involved in renin-angiotensin mechanism. When blood pressure decreases, the kidney secretes the enzyme renin, which initiate a series of reactions that result in the formation of angiotensin 2. These reactions, angiotensin 2 cause vasoconstriction and stimulate secretions of aldosterone by the adrenal cortex. Both will increase blood pressure. So, second function is this is hormonally we can tell that kidney have whenever blood pressure decreases, okay, what will happen, kidney have an enzymes, it will see, so I have reaching I got less amount of blood, so it will see continuously, he will see, then he will decide that I have one enzyme, I will release in the blood, so he will release, who, kidney will release renin. Okay, renin what will do? It will go to the, it will have, when renin release, we have receptors, that is angiotensin receptors. These are the receptors. So what will they will do? They will go to the arteries, veins to constrict. So whenever angiotensin to activate, the veins, arteries will see angiotensin is activated. So what we have to do? We have to constrict. We have to constrict. So they will start constricting. Okay. Next thing, what will happen? Aldosterone, angiotensin go to the adrenal cortex. Okay. He will tell to adrenal cortex, please release and please release aldosterone because the BP is low. So likewise, the functions will happen. So kidney will absorb. There is the low blood flow, low BP is there, low blood pressure is there. So he will release an enzyme called renin. Renin, after seeing renin, the angiotensin 2 is activated receptor. Then what will happen? Angiotensin 2, after seeing angiotensin 2, vasoconstriction will happen. Then again angiotensin 2 go to the adrenal cortex and he will tell the adrenal cortex, please activate, please release aldosterone because the BP is low. So then gradually the BP will increase. Okay. So likewise the mechanism will work. Here, which mechanism? Intrinsic factor. Heart and kidney both are involved here. Okay. Next we have nervous mechanism. So this is nervous mechanism. So here is the diagram. Whenever BP decreases, so kidney will release renin, renin will have angiotensin, will activate angiotensin 1, angiotensin 2. Angiotensin 1 what will do, it will uh, convert into angiotensin 2 by the lungs. Who will convert? Lungs. Then angiotensin 2 what will it will do? Two works. It will constrict, constriction will happen, and it will activate aldosterone, adrenal cortex. Adrenal cortex will release aldosterone. Aldosterone what will do? It will increase sodium and potassium reabsorption. What will it will do? It will reabsorb sodium. Sodium, when water is going, urine is forming, so it will collect sodium. It will collect water. So it will doesn't release more amount of water, more amount of sodium. And here BP will increase gradually. Gradually this will happen. Next is we have nervous mechanism. Nervous mechanism is also very, very important. Next we will talk about some renin angiotensin here. Some details is there, very, very important. Decreased blood pressure stimulates the kidney to secrete renin. So here renin is enzyme. Okay. Next, renin splits the plasma protein angiotensin to angiotensin 1. So what it will do? It will it is protein angiotensin. So it is like work as receptor also. Protein angiotensin to angiotensin 1. Next is angiotensin 1 is converted to angiotensin 2 by an enzyme called converting enzyme secreted by lung tissue and vascular endothelium. So who will convert angiotensin 1 to angiotensin 2? Lungs and endothelium. Vessels have endothelium layer, na? We studied in previous class that endothelium will convert angiotensin 1 to angiotensin 2. What will angiotensin 1 2 do? It will constrict and it will go to the adrenal cortex and advise to release aldosterone. Okay, this is the function of renin-angiotensin. Okay, now we will talk about how the nervous system will help to regulate the BP. Okay, regulation of BP. The medulla and the autonomic nervous system are directly involved in the regulation of blood pressure. The first of these nervous mechanisms concern the heart. This was described previously, so we will not review it. However, the second nervous mechanism involves peripheral resistance. It is the degree of constriction of the arteries and arterioles, and to a lesser extent, the veins. The medulla contains vasomotor center. So already we discussed in the heart chapter how the nervous mechanism is help. Please, uh, you can see the video. You can understood. Okay, here this is not directly. This is not directly involvement. It is with the help of peripheral resistance. With the help of peripheral nerves, with the help of peripheral resistance, it will do vasoconstriction and vasodilation. So basically, veins veins only the aim of any uh, any organ, any mechanism in the instincting factor or nervous mechanism. Both are aiming to constrict arteries or constrict veins or to dilate vein or to dilate arteries. So here, one thing you have to remember that every drug, so you can understood that most of the hypertensive drugs which are used in the allopathy are work on this area. Okay, it may be work on heart, it may be work on kidney, like renin-angiotensin 2 blocker. Okay, and it may be work on autonomic nervous system. It may be work on peripheral resistance. So basically, the drugs which are giving by the allopath, which will allow, which will not allow to constrict the vessel. Okay, this is very important. Okay, how the mechanism is happening, the allopathic medicines mechanism is happening. So from that persistence we are understand. So here we have the vasomotor center, where in medulla, in the brain, medulla oblongata, which consists of vasoconstricted area and a vasodilated area. So medulla have two areas. This is medulla. One area is the area which constrict the vessels, which constrict the vessel. Which area is di dilate the vessel. Okay. So basically dilation which will decrease blood pressure, constriction which will increase the blood pressure. Okay. The vasoconstriction area may bring about more vasoconstriction the way of sympathetic division of autonomic nervous system. Sympathetic vasoconstrictor fibers innervate the smooth muscle of all arteries and veins, and several impulses per second along these fibers maintain normal vasoconstriction. More impulse per second bring greater vasoconstriction, and fewer impulse per second cause vasodilation. The medulla receives the information to make such changes for the preceptors in the carotid sinus and the aortic sinus. The inability to maintain normal blood pressure is one of the aspects of circulatory shock. So basically here we have understood that medulla. So this is the area will understood. So this is the so what will happen when BP decreases? Okay, so basically in the carotid sinus, here we have the carotid sinus. This is the carotid sinus and this is the aortic sinus. It will inhibit it. It will absorb whether the BP increases or BP decreases, what will happen? It will stimulate vasomotor center. Okay, stimulate. It will give the instruction to the medulla. Sir, my BP is very low, so you have to do anything. You have to do. You have to help me. So what will happen in the medulla oblongata? So accelerator center means the vasoconstrictor center will activate. Then what will happen? It will increase heart rate. It will increase cardiac output, and as well as it will increase the vasoconstriction. Vasoconstriction will happen. Acceleratory center in medulla oblongata. Then BP increases. Okay, this is the one scenario. Next is if the BP increases, what will happen? Same. We have carotid sinus, aortic sinus, which will see the scenario and will send the intimation, send the uh, pulse impulses to the medulla oblongata. Sir, my BP is my heart is working very fastly, rapidly. So heart rate is increases. So as well as BP is increased. So please do needful to me. What will happen? Medulla oblongata. Medulla oblongata again we have cardio inhibitory center. Cardio's acceleratory center, cardio inhibitory center. It will release the substances and what will it will do? It will decrease the heart rate and it will vasoconstrict, dilate the vessels. Wider. Then what will happen? The BP decreases to normal range. So this is the two condition which help by the brain nervous mechanism. So we have for the regulation of blood pressure, we need help of heart, we need help of kidney, we need help of brain. So if anyone doesn't work properly, so what will happen? Whole mechanism will disturb. So one example I will give you that in the medulla oblongata, if the what will happen if some patient have any clot there, any hemorrhage, any bleeding will happen there. What will happen? So vasoconstrict area or cardiovascularity area, inhibit area, okay, will damage. So it will cannot control the heart rate. If the heart rate increases, the nervous mechanism is damaged totally. So basically, what will happen? The patient will not get nervous mechanism. So he had only choice intrinsic mechanism. Okay, after that recovery only of the medulla oblongata, he will get the help of nervous mechanism. Okay, so basically, this is the thing we have to understood. So we have different types of shocks. Is there cardiogenic shock, hypovolemic shock? Okay, this is cause of shock, stages, compensated shock, progressive shock, and irreversible shock. So now we'll talk about all two things. One we have hypertension. Let's talk about hypertension. Hypertension is high blood pressure. That is a resting systematic pressure is normal. This range clinics now considered 125 to 139 to the pre-hypertension. Systolic reading is 140 to 159. Diastolic reading 180 to 199. Maybe called stage 1 hypertension. And systolic reading above 160 is called stage 2 hypertension. Okay, here stage 1 hypertension and stage 2 hypertension details are given. So 140 to 159 is stage 1. 160 to 160 above is hypertension. Second stage hypertension. The term essential hypertension means that no specific cause can be determined. Most cases are in this category. For some people who are an overproduction of renin. So one example, one reason is renin, excess production of renin also reason for hypertension. Okay, we know about what happened in the when renin releases. Okay, and another thing is number of things. What will happen when you have hypertension? Artery damage of artery, rupture of artery, or damage of cerebrovascular. accident means brain or kidney damage will happen. Okay. So next is blood pressure also self damageable for the heart also, because they have to pump the blood, and again the blood will come rapidly and they have to pump forcefully. Okay, because the left ventricle is working continuously. So in that condition, what will happen? Left ventricle hypertrophy will happen. Means the amount of the size of left ventricle will increases. Okay, so these are the things will happen. I will talk in detail in medical medicine subject. So what are the things we avoid? We avoid smoking, nicotine. Okay, and we have to reduce our weight. Okay, salt intake decrease, and we have to exercise daily. So this is the best things we can do to avoid hypertension. Okay, next we have cardiogenic shock. Shocks are there, different types of shocks. Cardiogenic shocks because of myocardial infarction means the muscle of the heart is damaged. So what will happen? So heart cannot able to pump the blood. Okay, it will receive, neither it will pump the blood. So the blood in the body will store. So what will happen? We will see the patient have pedal edema, edema in the face, edema in the lower limb. Everything will seen. And some hypovolemic shock means the volume of the blood is decreased because of the anything, diarrhea, hemorrhage, bleeding, what it may be. That septic shock is due to the any presence of bacteria in the blood. So what will damage? It will damage the all the most of the vessels. So because of the damage of the vessels, what will happen? The blood cannot reach to the heart. It will give the shock. Okay. Next we have stages. Compensated shock. It may be in some small cases like dehydration, diarrhea. What we will do, we will advise the patient to take the saline, salt water, oral dehydration, ORS, or lemon water, or a pinch of salt and sugar. So it will decrease the dehydration. Progressive shock, it may be severe hemorrhage, the large amount of blood is lost. So what will happen? It will give the patient in more danger stage. Okay, so we have to give the blood infusion or blood transfusion to the patient to decrease the shock. Next, we have irreversible shock. So it is last and final condition of the patient. It is nearby death. So what will happen? Uh, if heart is completely damaged, and all body the infection is spreaded, kidney also not working, so it is the last stage of the patient, irreversible shock. No person can live in irreversible shock. So so I think we completed vascular system. So here we have the all the details. Okay, study outline, please study this. You have the idea about all the chapters. This is the uh, summary of all the class. Okay, next chapter is the important chapter, that is lymphatic system and the immunity. So in that we have detail. We will discuss about lymph vessels, lymphatic tissue, lymph nodes, spleen, thymus, immunity, and all these things in detail. Okay, so we will discuss in coming class. Okay, if anyone has any doubts, can ask.